probable cases. So 641 is the number that we've always reported. The 109 is a new number. When you think of probable cases, think mostly of a family where one person is tested positive and another family member has the same symptoms but has not gotten a test. This brings our total current number of confirmed cases to 56,428. That's the way we've always been doing it. And these probable cases are now up to 2,469. We're continuing to see a steady decline in the new daily cases from our record highs from early to mid-July. So today, you may notice is a lot higher than yesterday, but when you look at the 7-day trends, they are going in the right direction. They're going down. Sadly, we're reporting 13 new deaths today. That brings our total above 800 to 807 deaths to date. 360 of those deaths just in the last month alone. COVID is our third leading cause of death in Dallas County, and each life that's lost is, of course, one too many. It'll be a little over 300 more deaths, and it'll be the second leading cause of death. We're basing that against the total number of deaths for cancer and the total number of deaths for heart disease from last year. They don't keep those numbers in real time. They keep those on an annualized basis. At the pace that we're on, if we have another month like this month, and I pray that we do not, then it'll be the second leading cause of death a month from now. But if we keep wearing our mask and doing the things that have been working, then we get a good chance of that not happening for much longer than that. So we're looking at a lot of indicators. I want to talk to you about some of those indicators that are in the news. What do they mean? All right, one indicator that we're looking at right now in Dallas County is the R naught. You've heard the governor talk about the R naught score, or the R factor, some people call it. This is the reproduction number of the virus in the community. So essentially, this represents how many people each person who gets COVID is likely to give it to. So if you have an R naught of 1, that means if 10 people get sick, that they'll each give it to one person, and you'll have, once they're well, probably 10 more sick people. So you won't see an increase, but you won't see a decline. If you have an R naught of 2, it means if 10 people get sick, they're going to spread that to 20 people. Our current R naught is 0.87, okay, is a point that's considered 0.087. So that means if 100 people get sick, they're only going to spread that to 87 people. That will lead to a decline. Now I want to caution that our R naught less than 10 days ago was 0.68. These numbers move down slowly, and all these numbers, hospitalizations, infections, they move down slowly and up quickly. But similar to the stock market, you can't look at a 1 or 2 or 3 day move one direction or the other and read much into it. You've got to look at it on a weekly and 2-week basis. So that R naught number is better than we've seen in previous months. It means that we're reproducing at a rate where less people will be sick in the future if we keep it up. Another number that we look at is the positivity number. That number, unfortunately, looks obviously very bad in Texas right now. Somewhat better on the numbers that we have here in Dallas County. So let me find that. So our positivity rate is quite high for the state. I think it's today I heard it was over 24% positivity rate. So what does that mean? That means if 100 people went to get the COVID test, that 24 of them tested positive. Why is that important? Well, if the positivity rate is high, it concerns you that the people that you're testing are only the sickest people and that you're missing a lot of people. You'd like to see a positivity rate of around 5% in the community, according to the CDC, to indicate that your testing is adequate. Our testing positivity rate for Dallas County, we don't have it for all the private labs, but we do have it for all the hospitals. Our rate is, for just the hospitals, is lower than the state rate. It's a little under 16%, but as you can see, that is way higher than 5%, right? And so we've got some work to do there on testing. In that regard, I want to tell you this. We have changed the criteria for testing at our test sites so that any person without symptoms can get a test if you work for a company that is what we call a CISA employer. So an employer that is covered under the Cybersecurity Infrastructure Security Act, a federal law. They're all the companies that were open in some way while we were doing the shelter-in-place or safer-at-home order. This means all of our school teachers returning to school can get a test whether they have symptoms or not. It means our construction workers who currently could not get a test without symptoms can get a test as well. Why did we do that? Well, again, our positivity rate in Texas is way too high, so we need more testing. We all know that we need more testing. At the same time, the number of you who have come in for testing at our test sites is down 40%. And so for instance, at our Eastfield campus, where we can see 500 people a day, we were only averaging about 200 people a day. At our Mountain View campus, there's no limit, but the numbers are down from where they began. And we haven't met our 1,000 a day at Ellis Davis for quite some time either. So the hope is that we'll get more people in for testing. That may have a positive effect on the positivity rate, but it may also help, particularly our school teachers and some of the folks who are going back to work in getting that access to testing. Our plan is to watch that and see how many people utilize that, and to look for ways to broaden the group of people without symptoms who can get testing, to fully utilize the amount of testing that we have out there, while looking for ways to increase that. I had hoped that, and I was on calls today with Washington, that we would see a deal that seemed to be very close to happening that would result in more money coming to state and local government through the HEROES Act, this thing they're working on to extend benefits to you. We could use some of that for some of the things that we need to keep you safe. I was told as I walked in here that the Senate has adjourned until September without reaching a deal. That is, I don't know what we can do about that. That is very, very bad. Please call your senators and Senator Cruz and Senator Cornyn. Please, I don't know what they can do about that, but we are at a critical place with our schools starting. We need to a host of things to get done. We've got people who we have 30 million Americans, many of them right here in DFW, who are unemployed, who are relying on that supplemental benefit that's not being paid right now, while politicians bicker in Washington. So we really need them to get the job done on that, and we need the Senate to come back to work. Again, I was just told that. I don't know what we can do about that, but that is surprising and disappointing news. We've seen a steady decline in our hospitalization numbers as well. Most of late July, we hovered around 700 patients a day, and today we're reporting about 535 patients that are COVID positive. Additionally, our ER visits are down from record levels that we saw in July. July 14, we had a record of 844 ER visits in a 24-hour period compared to 607 is what we have now. Now, while this is all very encouraging, I'll caution you that even with the recent decreases, these numbers are still much, much higher the hospitalization numbers, the daily numbers are much higher than they were in May 1st. Okay, when we started this Open Texas, our daily numbers were around 170. Our hospitalization numbers were a fraction of what they are now. So it's not a time for the community to lose resolve on what they're doing. Masking is working. By the way, masking will not work as effectively. The CDC cannot say it is effective if we mask and then get within 6 feet of each other. So it's masking and 6 feet. It's also hand washing, it's frequent hand washing, and it's avoiding any unnecessary trips for things other than essentials, work, and outdoor exercise away from people outside your family. And it's particularly avoiding those things, according to doctors, that you just cannot do without other people outside your family breathing on you, okay? So an activity where people cannot wear their mask 100% of the time should definitely be avoided right now. If we do that, that is the best way for us to have less people get sick, less businesses or more businesses stay open and less go out of business, and get our kids back to school sooner rather than later. I know a lot of people are concerned about the students, and believe me, that is the number one thing that we work on every day is keeping kids safe, helping our superintendents figure out what is the best thing to do for not just for each school, but for each child and each group of children. We have groups working to advise on special needs populations, and groups working to advise on extracurricular activities and all sorts of different age groups. People that are experts on child psychology and all sorts of things are working on this. And I think next week we hope to have some recommendations out from that expert medical panel. Dr. Wong will have a lot of information about schools for you today. We'll have more next week. But I think the important thing for parents to know is, and I get it because I'm a DISD parent, my daughter is a freshman. Really everybody looks forward to actually going to their new school when they're going to a new school. So it's a real challenge for all of us. But we're going to have more information for you, and we're going to know a lot more, and our superintendents and our education leaders are going to know a lot more, and we're going to get that information to you long before you have to make your decision. So in most public schools, and most private schools for that matter, because almost everyone is following the health guidance to not start in-person instruction until September 8th, which means that you'll need to make a decision by August 25th, which means that we need to get you information as soon as possible. So you're going to get a lot more information before then, but just know everyone is working very hard, and when schools open back up, whether your decision is to have your child work from home for a time, whether your decision is to send your child back, everyone will be working around the clock and extra hard to make sure that our students and our teachers are safe. Let me see if we've got anything else here before I turn it over to Phil. We have a campaign called North Texas Does It Right, and you can help in the North Texas Does It Right campaign. We're calling on Dallas County to help stop the spread of COVID-19. You can be a part of hashtag NorthTX Does It Right by following the safety guidelines created by our trusted group of doctors and civic leaders. Do your part by following the Dallas County health guidance for the public outlined at www.dallascountycovid.org to keep yourself, your family, and our community safe from COVID. And check out our DCHHS Facebook page to see our friends at the Dallas Stars, the Dallas Mavs, the Dallas Zoo, and others showing how they stay safe by wearing their mask. For those of you who aren't wearing masks, now it's your turn. Please wear a mask. and all the success that we're seeing is because people are wearing a mask. I saw a sign the other day that it made me kind of mad and frustrated at the same time. It was a sign in a restaurant, not in Dallas County. I traveled outside of Dallas County briefly, and the sign said, if it makes you feel more comfortable to wear a mask, go ahead, wear a mask, but it's your decision about whether you wear a mask, and only your decision about what you do, something to that effect. And what the person who wrote that message failed to understand is, my mask protects you. Your mask protects me. So another way of looking at that sign would be, if you want to protect me, go ahead, but basically to heck with you, because I don't feel like protecting you. And that is not what we need to do. What we've got to do is protect one another. This is an incredible community that cares about one another, and we rally together to take care of one another. And we're seeing that from the vast, vast majority of people. And we can do this, North Texas, if we do it together. I want to remind those few people who are not complying with mask policies, or are throwing parties in their backyard, doing the sort of things that are leading to spread. And by the way, these get-togethers with friends outside of establishments, so backyard barbecues, etc., that's 70%, according to one study, of the spread in Georgia. So it's very important that you stay with your family unit, and during this time, avoid groups where you're not wearing a mask, whether that is all your cousins in the backyard, or whether that's going to a restaurant, taking your mask off, and eating in an indoor dining room. It's very important that you avoid those things at this time of great spread. We have some news on housing and evictions. I think most people know this from my Twitter, but there's a moratorium on evictions in Dallas County until August 24th, with 7 of our 10 justices of the peace. All of our, I think it's all of our Democratic justices of the peace, except for, I think it's Margaret O'Brien in Mesquite, and 2 Republican justices of the peace in North Dallas, did not agree to that moratorium. So I don't know if they're setting eviction cases or not, but they haven't signed that document. For the rest, they had moved it to August 24th, because we all believe that surely by then Congress will have done its job and passed some of these eviction protections and got people their extra $600 or $400 or whatever it was going to be. And now that may not be happening. But you can apply for emergency housing assistance at Dallas County Health and Human Services. I think Phil may have some more information on that, but we're taking applications through August 20th there. And if you are selected, you can get up to $1,500 towards utility, your mortgage payment, or your rent. So we encourage you to apply. And with that, I'll turn it over to Dr. Huang.
Thank you, Judge. As you mentioned, today we're announcing 641 additional confirmed cases of COVID-19, brings our total to 56,428, and we're also reporting 13 confirmed deaths, brings our total death count to 807 confirmed deaths. Last time we also reported that we would start also reporting the probable cases, so we have an additional 109 probable cases reported today and additional 7 probable deaths. Wanted to mention that on Monday, I rescinded the Dallas County Health Authority order for schools and instead provided guidance for the schools. we're proud of the collaboration that we've had locally in our community and with our superintendents and the work that superintendents are doing to deal with these complex issues regarding start of school and all of those issues. By rescinding the order and issuing the guidance, then the school districts don't have to contend with really the conflicting statements that were out there for local and state officials regarding whether it put their funding at risk. And we look forward to continuing to work together instead in the best interests of our students, teachers, and school staff. The guidance I issued includes the following: that schools, again, it's the strong recommendations that school systems should not reopen for on-campus face-to-face instruction until after September 7th, 2020. To mitigate these risks to students, also in-person organized sporting activities, music, theater, recitals, and choir should also not be conducted during those times when the levels of community transmission of COVID-19 that we're seeing are moderate or high, using our red-orange categories that we've been using throughout this. And also all in-person events and activities such as clubs, fairs, exhibitions, academic competitions should also be delayed during times when the level of community transmission is either high or moderate, as indicated in our guidance document. Again, we appreciate the work that all the school districts are doing to keep our students and staff safe. And again, also appreciate the difficult decisions that they're having to make in this situation. And we will continue to work collaboratively with the school districts and also appreciate the work that the advisory group is providing and working with that group. Want to mention one other new study that just came out from Stanford regarding vaping and COVID-19, just noting that youth who are using vaping products or dual using e-cigarettes and cigarettes are at elevated risk and actually quite a large increase in risk. The study showed about teens and young adults who vape are 5 to 7 times more likely to be infected with coronavirus. They're also almost 5 times as likely to experience COVID-19 symptoms like coughing, fever, tiredness, and difficulty breathing. We've been, certainly you hear a lot that young people think that they're not affected by this, that the age protects them from contracting the virus, or they won't experience symptoms of COVID-19, but the data is really showing this is not true, and particularly among those that vape. Teens and young adults need to understand if you use e-cigarettes, you are likely at increased risk of COVID-19 because vaping can also damage the lungs. That leaves you more susceptible to chronic diseases, including COVID-19. Last thing just wanted to mention is the judge pointed out we do have our emergency housing assistance program continuing to accept applications until August 20th. So we have one more week of that. It provides short-term rental mortgage and utility assistance to low-income Dallas County residents that live outside the city of Dallas but who've been economically impacted by the spread of COVID-19. And you can apply either online or on the phone, and the details are on the Dallas County Health and Human Services website. I just want to go through some of the graphics that talk about the things that the judge mentioned. The R naught, as he mentioned, indicates how much a person spreads it to other people. This is actually based on Parkland's data, estimates for R naught from Parkland data, and we work again with the modelers from the various hospitals, hospital groups, and academic institutions. This shows how, and again, when it's above 1, then that means it's the multiplying more, spreading more in the community. When it's below 1, then, and the more it's below 1, the slower it means that we're slowing down the spread. And you can see, starting back from May, how we hit that period where it was increasing, then decreased up till beginning of June, then saw that exponential increase after Memorial Day, saw that plateauing, then right before July 4th, saw really dramatic reductions that coincided with the beginning of the masking orders, first on the businesses and then individual masking orders. And since then, throughout July and now what we've seen through August, we have been under 1. As the judge mentioned, we are now at about 0.87. I'll show you some of the data on that in a little more detail. And then this is also just some Gallup polling for national polls, but shows mask usage. But you know, about 60% now on the week of July 27th to August 2nd. About 60% are always using a mask, another 21% sometimes. So definitely more than had been seen earlier from April. And again, that mask usage really seems to be very important for our being able to control this. And we really think that a lot of the impact that we're seeing is from the universal mask usage, increased mask usage that we're seeing, as well as the closing of the bars, and people still practicing the 6-foot physical distancing, washing their hands, staying home, teleworking, all of that. Next slide. This is some of the data. You know, this is the numbers of new cases that we've been reporting every day. You saw that it's a reminder of where we came from. We were plateaued during April. You know, remember the days when we had 100 cases a day and we thought that was a lot. Then we increased up and we said we would hit our peak end of April, beginning of May. We plateaued. We stayed level around 200 for a while. Then into June, hit Memorial Day, started really exponentially increasing. We saw 18 days straight of 1,000 or more new cases. But what we're seeing since that July 4th weekend, and remember we said before July 4th weekend, if we saw another Memorial Day, it would be catastrophic. It was right before that we had the masking, and we are seeing from that just that continual sort of decreasing in the number of new cases that are being reported. This is one of the ways also so based on this data, calculating the R naught on the next slide, this shows that R naught initially was very high. You know, for every case would expect to infect another 4 people. Now you can see similarly, based on the county-wide data, our R naught is less than 1. As the judge mentioned, it was about 0.87 currently. Next slide. This is the percent positives, as the judge mentioned, is another indicator that we're looking at. There's some difficulties in getting that data just because the denominator in terms of the total number of lab tests that are done, it's hard to get that. So for different populations, we can look at that. This is for, again, Parkland Hospital data, the percent positives that they've been getting, and you can see that there has been now a steady decrease in that percent positive. Overall now it's about 12%. One thing that changed in the hospitals, a lot of the hospitals started testing all persons, whether they had symptoms or not, before they went into surgery, and also before women gave childbirth. So we've distinguished that also. You can see that the symptomatic persons, those that have symptoms, the positivity rate's been about 21% in Parkland. For those that are asymptomatic, either again the pre-surgery or pregnant women, that's been about 3.8%. They reported that had gotten up to around 6, but it's now been declining also. So these are, again, some of the type of data we look at, but it's, again, there are problems with the various data sources. You've been hearing about some of the numbers statewide, but all of the indicators that we're looking at locally are showing this decline and improvement. Next slide. As we've talked about, we're still at the red zone. Stay home, stay safe. I'm just going to run through real quick the indicators that we typically use. So again, we've been looking at the available ICU beds. That's a number you don't want going down, and so we still have a pretty low relatively low number of available ICU beds. We hope that goes up. Number of suspected COVID ER visits in the last 24 hours. Again, we hit some peaks, but the hospital numbers are still sort of a plateau. They haven't gone down as much as our number of new cases, so we're plateaued around those ER visits still. This is the number of confirmed inpatient hospitalizations, and you can see that's gone down, but it still hasn't gone down dramatically. That's why everything, the message we cannot let up. It's still, we need to keep going on this and keep doing everything we're doing and go to the new normal. And the last one is the deaths. Again, we have a lag in the deaths. Those are the lagging indicator. We're still seeing some of that peak in the number of deaths. So I think that's all that I have for the data, and to graphically show some of the things that the judge was talking about also.
Any questions before we go to the slide?
I have a question for you.
Okay.
Judge, I know that you are encouraging essential workers like teachers to get tested. We've been hearing from people that are still having as many as 10-day wait times getting their results back. And I'm wondering how that also squares with, I know that we don't have wait times at a lot of these testing sites now. So
Yeah.
looking for an update from you on where we stand with testing.
So, on the question was, we're hearing, reports, and I'm getting them too, of people who are waiting like 10 days for a test. Let me do that one first. There's a couple of parts of the test. So, when we looked at this back on, July 28th, we had about a 92% of our tests were getting the results within 3 days. I know we initiated another check on that today. Did we complete that yet? Not yet. Not yet. So we'll have more information probably tomorrow on where that is. Obviously, it's not acceptable that the contractors take 10 days to get the results back on people. Each time we're checking through that, because it actually happened with one of our commissioners, that it took 10 days to get her and her staff's test back, and they had taken down the email wrong. So we don't know in each case what the hiccup is. The way that this test is running and the labs are running it, that just shouldn't occur. But it is occurring in some instances, so we're trying to see how we can improve on that. There were a couple other and she's not mic'd, so I'm just re-saying that. She was asking, what about testing? Am I hoping that teachers get tested? I'm hoping that people who are going back into a group setting will avail themselves of testing. Whether or not, I defer to Dr. Wong and others, whether it's a good idea for a teacher, probably isn't, for a teacher to get tested on August the 12th or August the, say, 14th, if she's not going to be, or she or he's not going to be back around people for, 18 days or something. But the hope is that as we get the testing to more people, just as you saw on that slide at Parkland, you're going to catch more sick people, and your positivity rate will likely go down some, because as more people that are asymptomatic are getting tested, then less cases will be positive. But that's what you want to see, because if you don't have enough testing out in the community and all you do is test people that are, sick as a dog, then you're going to miss a lot of people who don't know they're sick and who are spreading it to other people. And that's what leads to these big spikes. The spikes go up very quickly, but they go down very slowly. So we're trying to keep that from happening, particularly in our schools.
Yes. Ask what is being done to look into these labs and the issues with the lag in people getting test results?
So we are running our own test. I'm not sure exactly how the doctors do that, but we're validating the information that they're given it by running the numbers ourselves. When they got the test and when they got the results, by taking our own sample and doing that. And probably tomorrow or the next day we'll have that back. And I forgot to say your question. The question was, what is being done to validate the number of people who are alleged or getting their test back in 72 hours, and what's being done to try to find out how many people are not getting their test back. And that's where we're running our own test. And then what will be done, maybe a follow-up, is what will be done with those who are lagging, where we're wasting 10 days to get them the results back from our contractor. We need to find out what that mistake is and get that corrected. So we'll look into, for instance, if you're taking down email addresses wrong, how can you improve on that so you get the right email address now?
But are we looking into that?
Yes, we're looking into both those things. Job one is to find out how many people, but from our statistical sample, are getting their tests back timely and how many are not. And then job two is to look at what's happening on the statistical sample as to why they're not getting it back timely. Is it a lab issue, which so far it hasn't been, or is it a contractor issue, which so far it has been? All right. Any?
Hey, Judge.
Hi, how are you?
Hi.
I was wondering, that's kind of cool. That's,
I know, sorry,
yeah,
I wasn't able to be there. I apologize. I'm with NBC 5.
yeah.
This question is for you, Judge, or Dr. Wong. I'm looking into Seagoville, the federal prison. their cases went down significantly. I'm wondering if you could speak to any of that, or do you have any information as to what led to this significant drop? I mean, we were at like 66% of the population in less than a month ago to like 2%, it looks like. Do you have any insight whatsoever?
Well, I don't know specifically, since it's a federal facility, exactly what was done there. But what we do know is masking is having a profoundly good effect. And of course, when people are incarcerated, you can force compliance on them. And so if people are masking 100% of the time, it is very difficult, if you maintain 6-foot distance and wear a mask, to transfer it to one another. We've had doctors tell us that in their practice treating COVID patients, they haven't had it spread to anyone because they mask both. Now that's not, a study, but that's just what local doctors are telling us. So masking is really working, and all of these things show us the importance of why we all need to continue to do that and not drop our resolve. I want to also remind you, on the resolve piece, when the governor did Open Texas back in early May, UT Southwestern quickly did a model, and they said if they believed that on July 1, based on what he was doing, we would have between 800 and 1,200 cases a day. The difference between 800 and 1,200 was whether 57% of the people did what the CDC was recommending or 60. If it was 60, that dropped a third of the cases a day. It dropped from 1,200 to 800. So you've got people that are going to wear that mask, wash their hands, avoid those trips. You got people that aren't doing that right now. If those people in the middle that are doing it but hate it, the mask is hot, I'm tired of doing this, if they lose their resolve, it just takes 2 or 3% of them to throw us all back into the frying pan. So we've got to keep that resolve up. Any other questions? Though I think that it's pretty cool technology, the way you set that. These people, I just realized nobody has any idea what we're talking about, but I'm talking to a phone stuck on a camera. Is there any other questions before we wrap up? Let me just close by saying you guys are incredible. I'm not talking to the media, but you are incredible. But I'm talking to everybody out there who's wearing their mask in this heat, who is struggling through what's got to be the worst collective summer of our lives, and doing it with grace towards each other. Just keep doing it. Things will get better. We will get through this together. God bless you. I'll talk to you soon.